إنا إليه راجعون أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون. This is the translation. And we will surely test you with something of danger and hunger and a loss of wealth and lives and fruits. But give good tidings to the patient who, when disaster strikes them, say, indeed we belong to Allah, and indeed to Him we will return. Those are the ones upon whom are blessings from their Lord and mercy, and it is those who are on the right path. Sadaqallahu al-Aliyyul Azim.
Jazakallah. Thank you very much, Dr. Farooq. That was beautiful recitation and powerful translation, just appropriate to the timing. Assalamu alaikum, everyone. Good afternoon. Welcome. Thank you, everyone, for joining this lecture. This is our first Zoom lecture, as Dr. Rehana mentioned. Since we started talking about this lecture, I have been noticing one of the major things that have affected me. Like, we are having every day different changes in our life, different stressors. Things are changing, norms have changed, daily life is changed, routine is changed, and daily stressors are changing, and there is a lot of unpredictability and uncertainty, and that has affected everybody. And I started thinking about what a wonderful topic it is to talk to the community about it. And I hope we can address some of the issues and guide and share some thoughts how we can decrease this stress, which is uncontrollable and very unpredictable. So once someone said, it's not the stress that gets us, it's our reaction to it. Let me see, how many of you are feeling like you can't catch a break? You're feeling lonely because of the personal interactions you cannot have. There is more work at home, with the children being home, sleep patterns have changed, routines are off, not sure about when and if things will come back to the normal again. And now with Eid coming up and not celebrating as we used to, you know, feeling unsure. So, well, let's see what can we do in this kind of situation. First of all, I want to talk about what is stress. You know, stress is a normal body reaction. Ancient saying is fear and flight. Whenever we are under a certain situation, we get stressed. Our body releases some kind of chemicals and we get stressed. There are three types of stressors. One is a good stress, one is, you know, long-term stress, one is trauma. We're not going to talk about trauma today. So good stress is good. That is the stress from our daily life, our job situation, work situation, family situation. And there are good things that come out of that stress, that we get stressed, we get nervous, we bring up our energy, we bring up our phase of challenging the situation, and that helps us to perform and produce, and we are better productive human beings. So that's a good thing. If we don't have that, we might not be productive, we might not have motivation, we don't have energy. So having no stress is not good. So that is, I'm talking about healthy stress. Then there is too much stress, unhealthy stress, chronic stress, which we are facing right now. So in those situations, there are certain ways our body reacts. I'm going to divide it in three ways. Like, you know, we have physical reactions to it, we have emotional reactions to it, we have cognitive reactions to it. By calling it physical reaction, I mean our heart rate goes up, we get tired, we are having trouble with our sleep, we can't rest, we are feeling tired, we are feeling sick, stomach upset, a lot of physical symptoms can happen. Then is the emotional aspect of it. Emotional is, we see some people irritable, sad, nervous, scared, fearful, and that those are normal reactions. I see a lot of those people in my clinic nowadays, that a lot of college students, a lot of young people are feeling anxious, nervous, stressed. So we need to take care of that. Then comes like you can't enjoy the things, you are irritated, you are frustrated. So we have to, why I'm mentioning all these is one has to pay attention to identify what's going on. And I always say that once we identify the problem, then we can figure out how to resolve the problem or how to get to the solution of it. Someone can be more tearful, some can be more agitated. So all these things, if they get too much and it is interfering with the performance of one's daily life and one's activities and one's capabilities, then they need to get some professional help. Then is the cognitive effect of stress. Cognitive effect would be where we are feeling scared, we can't pay attention, we can't concentrate, we are unable to make good decisions, we are making poor judgments in different situations. So these are some of the things. I have heard people saying, I'm feeling like crazy, I'm losing my mind. So those are the things that we are supposed to be paying attention to. How is my body responding to the stress? Again, it could be physical, like every day you're having some ailment, you feel like sick, you're tired too much. Then you can be irritable or agitated. These are the common ones I'm seeing. Then it is like I cannot focus. Not everybody is going to have ADHD, because during this stress time I cannot focus. So pay attention that you are stressed. So then once we identify it, then we can pay attention to take some measures how to decrease that stress. So these are all the signals. We have to be very careful. So then related to COVID, what has happened, what has caused all these stressors is that everybody, and I'm also feeling that everybody's routine is messed up. No one has a routine. No one has a break. We used to take a break. We used to get a break, go to the mall, go to visit your family, visit your friends, go to a party. We are not able to have any of those things now. We used to have our coping mechanisms. We used to have our relaxation things. Someone will go to the gym. Someone will go hang out with their friends, go to a restaurant. We're not able to do any of those. At the same time, our responsibilities, our duties, our expectations have increased. A lot of us, schools for children have been canceled. They are staying home. Husbands are working from home. Women who are working, they're working from home. Yes, it comes with a great pleasure that we are all staying at home. However, working from home have brought different challenges. For mothers, workload have increased. Children are home doing unstructured activities. Everybody is, being loose, no schedule, no expectations. And so these are all combining and making a lot of stressful situation. On top of that, the stress is being very unpredictable. Every day we are hearing different news from about COVID. It is very unpredictable for all levels, for health department, for a layman, for the doctors, for the patients. Everyone is under this kind of limbo, like what is true, what is not true. Some people are calling it a conspiracy. Some people are calling it, you name it, whatever you have heard, lots of conspiracy theories behind it. So the stress is ever increasing. Now I'm going to go talk about how can we manage the stress. I would break it three big things, how we can manage the stress. Number one, we can change our mindset to look at the stress. Number two, we can do some activities. How can we calm ourselves down? And number three, what can be the relaxing measures, or what can we do differently? So going through that, how can we remove and change the stress? Number one, I would say for me, it's a big one that we all are this perfectionist and we feel like we are power women. We can be the best mothers. We can be the doctors. We are guilty ourselves of never saying no. We feel like we can do everything. And then at the end, we do get stressed and we get sometimes burn out. So my biggest thing is learn how to say no. It's okay sometimes to say no. It's a big thing in our psychiatry community to teach people that we want to have healthy boundaries. Healthy boundaries is, okay, today I have too much work, I cannot perform. I cannot do this. I cannot do everything. Then is manage and delegate responsibilities. Like as a mother, you cannot do everything. Children are home, make lists of tasks, divide them, have a husband do some things, have children do some things. Make it fun, make it a team. It's like a team. Think of it as a like a little organization, little setting where everybody has to pitch in. The next is take breaks. Like don't have to be continuously watching the news, reading the news, watching the TV. Take break. Designate a limited time to watch TV, to watch news. You do not have to watch news 24 hours 7 days a week. That is the biggest stressor, and I have to advise a lot of my patients, and that does help. It works for me also. Like there are days that I don't want to listen to the news because there is controversy, there is back and forth information. I don't want to see all those sad things happening in the whole wide world. It doesn't make me a better human that I watch news 24 hours 7 days a week. After that is next, how a person see a stressful situation. We have to learn how to change our attitude to, like, we have to be feeling like we are not alone in this stress. We need to be talking to others. When you talk to somebody else, you feel like there are other people who are also in this stressful situation. That is a big relief for me when I find out, oh, I'm not alone in this. There are other friends, my other family members, they are also feeling the same way. Otherwise, if you stay in your home, you close yourself down, you feel like you are stuck, and you all the negative thoughts come in your mind. Our brains are very interesting. They dig these circles, they make circles, and we go trap in those negative circles. So call friends, call people, talk to other people. Yes, we are not able to visit, but we can call on the phone, we can do FaceTime, we can do Zoom meetings. Next thought is how to lower the stress. Lowering the stress, there are lists and lists you can find on internet, find on Google, and you have to choose what works for you. There are lots of things, including regular exercise. My big thing is routine. Couple of things which I have advised my patients every day is keep a routine. No matter you're working from home, no matter you're not in school, you have a schedule. Keep a schedule. Wake up in the morning, make your bed, get dressed, look good, eat regular meals, eat at regular time, eat healthy meals. And other big thing is go to sleep at a routine time. Lots of people are watching movies all night, sleeping in all day. That is a backward cycle. We are created with nocturne. We are like at night, we are supposed to sleep. I'm big on teaching sleep hygiene. Go to sleep at 10-11 p.m. We are supposed to sleep before midnight, and we are supposed to have 6 to 8 hours of sleep every day to function normally. Otherwise, if you don't sleep well and if you don't sleep appropriate hours, you are irritable, you are tired, you're fatigued, you are not a good productive person. No matter how many hours you sleep during the day, that quality of sleep is not equal to the quality of sleep that you get after at night. That's how our bodies are built, and that's how our bodies are programmed. Then is stay calm, maintain, again the same thing, maintain day-to-day normal. There is a huge thing that maintain a sense of normalcy. And I know in my audience there are mothers, there are fathers, there are students. Everybody in their phase of life, you have a sense of normalcy. A student goes to school, is so many hours in school, then they come home, they do their homework. So you make your own calendar. A mother has a sense of normalcy. She's feeding her children at different times, making food. So please don't make yourself feel like you're a victim of stress. Try to conquer it. And once you have that feeling, you get that control back. Big thing that stresses us is when we feel we don't have control. We want to be feeling safe in our person, in our family members, in our loved one, in our belongings. We want that I have a control. I can protect these things. The moment we lose that control, that is when we get stressed, we get anxious, we get nervous, we get sad, depressed. It's a vicious cycle. So I would request all of you to gain that control back. Yes, we cannot do anything about the virus, that is a fact, but what best can we do to gain that control? I like it when I have my routine in my control. I have my, planning, my timetable, my schedule for the day, whatever you want to call it. There is some control that, okay, I'm going to have at this time, I'm going to get dressed, I'm going to go to work, I'm going to sleep, I'm going to eat at this time. So that is a huge factor. If you try that, you will feel that. Um, my big advice would be, yes, you are staying home, you're not working, many of us are not working. Still, please go to your closet, put on the best outfit, put on your makeup, be ready. You look good and you feel good about it. You feel good. I like it. Like today, when I was getting ready for this lecture, I even put a perfume on. I hope you guys can smell it. I'm like, we have to boost our morale. We have to take care of ourselves. So after all these things, a big thing is take care of yourself. Find some time to do something that you like. Read a book, go for a walk, go talk to your friend, go talk to a confidant. You are worried, you are stressed, you must have somebody who you can share those thoughts with. We are social animals. Humans are social animals. When we talk to other people, sometimes we need a bouncing board. We just share our thoughts, the other person says the same thing, we feel much better. So these are, and then the connection. Biggest thing is, based on that we are social animals. Maintain a connection. Do not feel alone. Do not feel lonely and stuck at your home. Have that connection. And I have seen a lot of people doing different things. I heard from one of my patients that they did a drive-through birthday party. It was a very unique idea. I heard about it first time in my life. What they did was, they were 6 7 friends. They all sat in their cars and they drove in front of the friend whose birthday it was, and they honked their cars. And what a good idea. You all feel good. We all have those happy hormones releasing. So we all have to find our own happiness. We all have to find our own ways to get there. So feeling connected, call people, call your parents, check on them, check on their safety, give them advice. I hear a lot, after that, I hear a lot of times people are complaining, I have too much time on my plate. I start thinking negative when I am free and I'm thinking, go volunteer, go do something good. So doing something, there are studies, they have shown when you give, your happy hormones are released. When you give a hug, happy hormones are released. When you give gifts, happy hormones are released. So right now, yes, we cannot give hugs, but we can definitely give gifts. um, Everybody's home, cook something for your neighbor who is elderly, cook something for your neighbor who cannot cook. um, I would share a couple of my examples, and I felt that was very unique. Like, my kids love baking. They started baking these cookies, and I'm like, it is very dangerous. We are stuck at home, and you're baking these good tasting cookies. What are we going to do? So they made small packets and they distributed it to their friends. So they spreaded that happiness among a group of people. I have a friend who went and picked up grocery for a neighbor who was elderly. She was at risk. She could not go pick up grocery. So she's delivering grocery to her neighbors. So we need to do all these different things. Then I would stop at, social distancing does not mean social isolation. We all have to remember that. So I might be, repeating something over and over again, but I cannot emphasize enough how important it is to do something, to get together. You can even meet somebody at a 6 feet distance. It is huge. It is very powerful to see people, um, and interact with people, share your feelings, and do those things. Another thought is that take positive steps, focus on positive things. There is another thought that no matter what is going on, normal life is going on. So we should be thankful. We should be thankful to the higher powers that at least we are able to do some positive things. Some of us are able to work. Some of us are able to, take care of other people. Some of us are able to take care of their families. Some of us, they have their parents living with them. I have known friends, their children were getting married and they did go ahead and done those weddings in a different way. So we have to focus on all these positives that we have in our lives to keep going. Focus on the positive things in your life. Focus on the things that you have control on. I think I have covered most of the things, and I will open the panel to the questions. Dr. Heather will be answering any of your questions related to stress. Dr. Farouk would answer any of your questions if you have any questions related to COVID. I wanted to add one thing, and I'm going to have Dr. Farouk address that in this situation, we can feel relief if we have a plan. What would I do, God forbid, if I have become sick? So there should be a preventive plan. First of all, like we need to increase our hygiene, use the cleanliness, using the disinfectants and all that. But still, if I get sick, where do I go get testing? What do I do? So I will leave it for Dr. Farouk. She can give us a little plan that, like, we have an emergency plan. We all know in the schools, they always have a falls fire parades and fire alarm parade. So that gives a relief that we all know how we can plan if the bad thing happened. That would give a little sense of control also.
Sure, thanks, Dr. Chowdhary, for that question. So yes, prevention is the best possible solution to this pandemic. But God forbid you do somehow end up getting exposed. The first thing that you do is you don't panic. I would say start by taking care of yourself. Stay home, call your doctor, and stay in touch with them. Not just one phone call, but give them an update. Now, a lot of the doctor's offices have their own SOPs. So when you call them, give them your exact symptoms so that they can guide you. Some of them only do televisits if they hear that you have positive symptoms to prevent exposing other people. Some people have certain specific office hours. So just call your doctor and tell them exactly how you're feeling and then stay in touch with them. So, majority of the people who get this, and I'm sure you've heard a lot of people say this, is that they're not the ones who will not necessarily get severely sick and fall into complications. So your chances of getting through this are good, but you have to take care of yourself, stay home. When you're sick, avoid public places so that you're not spreading it to anybody. And at home, separate yourself from your family. Stay in one specific room, try to have your own bathroom, wear a cloth mask covering during, even at home. And then clean the highly touched surfaces frequently so that you're not spreading it further to your family, like the phone, keyboard, doorknob, light switch, things like that. And hydrate yourself. And then be in touch with your medical provider to make sure that you're staying on top of if there's any latest recommendations, because this is an evolving disease. There's constantly new things out there that they can recommend to you depending on your underlying immunity and strength to fight this. So I would say that if you are sick, don't panic and start, being ahead of yourself. Now, one thing I want to add to Dr. Chowdhary's presentation is that physical and mental well-being are very much interrelated. So if you're in a prolonged state of stress, your flight and fight or like active overdrive, it starts affecting your physical condition as well. And then we see patients with, uncontrolled blood pressure, their diabetes is out of control. They start getting arrhythmias, and it can go and progress to even further complications. So try not to stay in a state of stress for too long. And just as we say there's personal protective equipment for your physical well-being, there's also mental protective equipment: sleeping, diet, exercise, looking to connect, reflecting on yourself, and reaching out for help if you need it, just like Dr. Chowdhary outlined.
Thank you very much, Dr. Farouk. Now, there is a question, and please, all of you, if you have any questions, type it into the chat, and we will get those and we will answer. Dr. Heather, you have a question. Please go ahead and answer that question. Dr. Heather, your mic is off. Can you turn on your mic? Dr. Heather, your mic is still off. Yes, you are on now.
Can you?
Okay.
Okay.
Yeah.
Yeah.
So
So
thank. Yeah.
yeah.
So
So
first
first
of
of
all,
all,
There is a lot of
yeah,
echo behind you.
I
I
can.
can.
Is
Is
it
it
better?
better?
Yes, that is better. Thank you.
Mm-hmm. Okay. So yeah, I was saying that the question I see in the chat box, yeah, I feel like some of them you have already addressed in your talk. Hmm. So I will start with the question that another question that we have received. And are you able to hear me right?
Yes, you're fine.
Okay. So we have received a question that is asking that me and my spouse are getting into too many arguments in the house. What to do? And another question related to it, so I'll address both of them together, is my husband has this fear of losing his job. He's always talking about it. How do I handle that? So first of all, I want to say that, like Dr. Humera Chowdhary has been telling us about the unpredictability and that feeling of like loss of control that these days we are experiencing because of the pandemic. But I would say there are still some things that we have control on. And one of them, I would say, is that be kind to each other. So that is very important, especially for the couples. Yeah, that be kind to each other, acknowledge the stress that the other person is experiencing, and give this feeling that you are not alone in this, and we are in this together. So that would be the primary thing. If there are arguments going on, I would say just sit together and then try to figure out what are the areas of conflict or the areas that are causing these arguments. Try to find out, identify the problem, and then acknowledge that there is a problem. Yeah, exactly what Dr. Chaudhary has been saying about like what causes stress. So once the couples are able to do it, there's hope that there will be improvement in the mutual relationship. Also, communication, how we communicate with each other, that is very, very important. So these are some of the things that I would say. Take time out for each other, just sit and do like a focused discussion, other than like daily discussion or daily talk that the family has. Because these concerns that the spouse has, there may be some genuine concern. The individual may be actually like, worried about how to pay the rent, how to pay the bill. Would that person be able to get another job? So there can be several things. Yeah. So communicating well, showing kindness to each other, acknowledging there is a problem, and try to problem solve it together.
Thank you, Dr. Heather. You covered it very well. I'm going to take a question from the chat. There is a question. There is an increased pressure of performing more activities because we are sitting at home. How can someone who has realized this manage this pressure? There is a lot of overlap again. I would say biggest thing in this situation is that we are spending more time with the people we were not spending more time with. So we can turn it into a positive or we can turn it into a negative. Some families are feeling it as a blessing that, like college children, college was canceled after the spring break. They have been home. Homes were empty. Now it's a full of children. However, it comes with its own stressor. So what I would say is, first of all, we have to identify and acknowledge the stress. Everybody's under the stress. So no one person's stress is more than the other person. We all have to be acknowledging it and appreciative of each other and understanding of each other. So this question is that we have to perform more activities sitting at home. So that is possible. It is just a different way of living. Normalcy have changed, different norms. We are living with different norms. We are glad to be alive, we are healthy, we have resources, and then depending on your family and your family's resources, there are very, very less expensive things that we can do. I'm big on We don't have to go to Europe to feel good. It's the mindset. If you think about it, you have to have a mindset. You appreciate the stars, the moon, the early morning walk. You appreciate the sunrise. You appreciate the birds. Those are the things that give you joy. So activities, the same thing with activities. I have always advised you can pick small things and make it fun. It's all about mindset and how you look at it in a positive way. Like you can have your children involved in baking. You can pick up crochet. You can pick up knitting. You can pick up. I know. I hate using my own examples. My youngest daughter was very stressed. She has been out of college. She was a first year college student. She was sent home in March, and I told her, "You're not going to go back." But she was persistent. "No, mom, I'm going to go back." So I stayed quiet. So she's a very high performer, high achiever, always wanting to do things, always wanting to do better. She picked up crochet. She knitted a beautiful blanket, a huge blanket, like I think 8 feet by 8 feet. And, and that gave me idea. And I have been telling a lot of my patients to do that. And that's not a very expensive activity. You just buy yarn, buy a needle, and do crochet. That's a simple example. Same thing. And these are rewarding. When you make something and people appreciate it, it's very rewarding. So please pick some simple activities, not expensive activities. Go outside, maybe sit outside, talk about things that you have never talked about. Tell your children your childhood stories. Tell your children about your grandmother, about your grandfather. Make this a point to get to know each other better. So make a goal that we are going to come out of this pandemic stronger and better. And I think if we have some clear goals, we can all do better. I hope that answered that question. Then Dr. Heather, you had another question. The one where...
Yeah, we have a lot of overlap. Like you said that there was a question about, I feel too tired. No, we miss going out to the mall. What other activities can we do? You already addressed that.
Yes. Okay. So there are others, we have to be creative.
Then we have a question about I feel too tired taking care of children and husband all day long. How can I make my spouse and children share housework? So that also we kind of addressed it, part of it. Sit together, talk, acknowledge everyone's stress, what everyone is stressing about, finances, children are stressing about their school, not being able to go to school, see their peers, get out of the house. So everyone, and mothers, of course, yeah, they have their own areas of stress. So communicating well, listening to each other, giving each other time to express everyone's areas of stress, and then have like clear expectations from each family member. It's okay to make a list. I think that's perfectly fine to make a list, delegate tasks. That way family will stay busy as well. That will address that earlier question too, too much time or like free time or everyone staying home, what to do. So True. It may kind of sound easy to say and not as easy to do, but at least one can try. So this is like some of the things that one can do. Clear communication, clear expectations, and assigning the role, delegating the task. Mm-hmm.
And I totally agree with you, Dr. Heather, on that. By doing that, there is a lot of frustration is removed from the mixed picture. That, mm-hmm. Sometimes mothers get very frustrated. Why is not somebody washing the dishes? Why is somebody not cleaning the kitchen? I did all the cooking. Why don't somebody set up the table? So please divide all these daily activities into small tasks and make it fun for the children. Like 7-8 years old can do something. The 10-year-old can set up the table. 12-year-old can load the dishwasher. Mom can unload the dishwasher. So breaking, I call it to my patients, divide and conquer. So why don't you make a list, delegate the jobs and get done. And then we can even have a little treat at the end of it. Whoever done their job, they get a little ice cream. They get a little, less than less than $1, something in a positive, some sticker, something, or appreciation or a hug. One more thing I would add, Dr. Heather, that we forget to appreciate each other. Under stress, we forget,
Very true.
right? So we need to, and it's a vicious cycle. Like they say, anxiety and stress is vicious. Love is also like, it's very infectious. You give love and they all give love to the next person, to the next person. So one has to start. And as a mother and father, you can start that all the time, and you have happy child, happy faces, and on and on. So there is a question that if someone doesn't, sorry, I was going to take the anxiety one. How can we manage our own kids' anxiety when they have to go to school or not going to school? It's tough to take decision and prepare kids mentally, as well as lack of sports activity. How can we address kids' anxiety? So again, this question goes back to fear of unknown, unpredictability, uncertainty. So all these things cause a lot of emotion and a lot of negative thinking and anxiety. So what I want to break it into a few big bullets. First of all, we need to acknowledge their stress. That yes, I understand it's a stressful time, it's unpredictable. Yes, you love going to school, we don't know where to go. And then we have to use the facts. The most important thing is that many times as parents, we don't want our child to be stressed. So we resort into going into, don't tell them. They are just little children, don't tell them. Or we go into a denial that if we talk about bad things will happen. No, it's a value in facts. Go dig the facts out, talk about the facts, and talk about what you are doing to protect from those facts. Staying in a blind is biggest thing that causes anxiety, because it is fear of unknown. Remember that. So please know as much as you can. Find out what COVID is, just the facts, not the conspiracy theories, not the stories which are uncertain, like this is like they're trying to get rid of this race and they're getting rid of this and they are selling the bodies and they're killing injections, and none of those. Please do not spread rumors. Do not listen to those rumors. Check the facts, check the resources where those facts are coming from. And that is what you teach your children also. Again, the same things. Children should not be listening to those rumors and stories, but you give them the facts. I'm very big on, as a child psychiatrist, that whenever there is an unexpected situation, even in normal life, during growth, there are certain areas of life like drugs, sex. I want parents to be the first one to talk to their child about that. Same thing with here. You should be the first one talking to your child about COVID, dangers of COVID, and what as a parent I'm doing to protect you. I think that is huge. Children count on their parents. If parents are nervous and anxious and unsure, child is going to be anxious, nervous, and stressed. Parents do not realize children are very sensitive. They pick on your anxiety. They pick on your body language. They are very picky. They're very sensitive to mother and father's emotions. So we have to be careful. We should not be, the child says, oh, mama, you look scared. Oh, no, I'm not. No, listen to the child. Yes, I am scared. It's okay to say I'm scared. It's okay to share with them that I'm also vulnerable. That gives them power that, oh, mom also feels scared. But these are the steps mom is taking. So let's do it together. Make a little spray bottle for the child. Maybe have them disinfect the grocery bag. So they see those things. We try to protect our children and sometimes do all of this without the child knowing. Of course, the child is going to be nervous. When the child knows, okay, mama brought grocery and now we are disinfecting, we're getting rid of the virus. So child will feel peaceful. I hope that helps. So the next question, Dr. Farouk, is if someone does not have a primary care doctor or insurance gets sick, what would you advise? Do they just quarantine at home or watch their symptoms?
So that's a good question. So you don't necessarily have to have insurance. There are sources out there that do test in labs, and you just have to make certain phone calls. So you don't necessarily have to have insurance for testing, depending on your age and situation. Now, the testing is, it's a good question. You don't necessarily have to test everybody. If you feel like you have the symptoms and you're exposed and you're pretty sure that you have it, you can very well isolate yourself. With the new guidelines, you can isolate yourself for 10 days, and when you're fever-free for 24 hours and symptoms have improved for 24 hours. And you're a responsible person and you've taken all the precautions, you don't necessarily have to test. A lot of people are getting tested because now the testing availability has increased. And so, yes, who to test is somebody who has signs and symptoms, somebody who's asymptomatic but has a known exposure, and is living in a specific setting. Like if you don't test yourself, you will impact, it's elderly, it's somebody. So I would say that if you are not too sick and everything is okay, then you can isolate yourself and get through this. Now, if you are very sick, be sure to identify that case, and then you do have to seek treatment. So that's when you start having trouble breathing or having chest pain. You feel like your family notices there's a change in mental status. Your lips become blue. You're too sleepy. So that's when you should definitely seek care. But you don't necessarily have to be tested. Now, there are a lot of drive-through pop-ups coming up. You don't have to necessarily have insurance to be screened. So keep your eye out for that. People are offering health screenings. People are offering COVID testing. So just keep your eyes and ears open in the community for that. And so hopefully you can find some help with that.
Very useful. Thank you, Dr. Farooq. I hope we are answering most of the questions. If anybody feels their question has not been answered, please send it in the chat box again. I saw a question about why is it important to sleep before midnight, even if you end up consistently getting must be a teenager. What advice do you have for future or current medical student professions who might not be able to sleep early due to their schedule? Very good question. The biggest thing is 6 to 8 hours of consistent sleep. And our bodies are scheduled as, I should call it, we are supposed to function during the day, daylight, and then at night we are supposed to rest. It's our biological clock. And there are chemicals released in our body like melatonin that kicks in at sunset, and it tells our body time to rest, time to go to sleep. And if we counter that body clock, it won't affect you the day after, 2 days later, it won't affect you in a week, but it will start showing effects if you do it consistently. Medical students, yes, they have difficulty following a schedule, but I still remember my physiology teacher, Dr. Madan. She used to be so big on, at least she used to say 6 hours of sleep. And we used to feel like, how can we live with 6 hours of sleep? She was like, all you need is 6 hours of sleep. I still remember, but she did it so well that it hit us that we would make sure if I'm going to sleep at 12, I'll wake up at 6, not 5. If I go to sleep at 10, I'll wake up at 4. So she gave us that mindset that at least 6 hours is enough sleep. And then you take a nap during the daytime. Never take a nap late afternoon. That is going to mess up your sleep cycle. So please look up sleep schedule. It will answer more questions. There was one more question. I think we have addressed that how do we replace the socialization? So there are ways.
Yeah.
Right now what we are doing is a great way. Zoom meetings, we have never done that. This is a great way to see each other's faces, see each other's emotion, and then connect to it. We can get dressed and come on the Zoom meeting. We can have family gatherings, family parties. It's a great opportunity. You can designate a time. Hey, Sunday at 12 o'clock. You can have your out-of-country family join. You can even have your cousins who you have not seen in ages. You can do it with your class fellows, with your friends. It's a great resource, and it's not expensive. Zoom is very non-expensive and very easy to use for everybody. Anything else that we are missing? Or any feedback, anything from Dr. Rehana? You have any questions that you can think of that people have not asked yet will be helpful for people?
Yeah, I was thinking about, let me see, I had written a question for you. Let's see. Oh yeah, I was also suggesting that right now they can learn languages on online. The free languages, free courses. There are a lot of community colleges. Uh,
Mhm.
I mean, doing free courses, like they're
Yes,
non-credit
yes.
courses, and people can. This is just staying home. They can learn language. They can learn about any issue, gardening. I mean, how to cook,
Hmm.
how to manage your finances. There are a lot of these things people can really learn during this time.
Mhm.
Only
Yes.
if we stop worrying so much about things and try to concentrate on the positive things that we are going through right now and manage the time better, because it's going to end one of these days. It's not going to last forever. All these bad things happened in the past.
Mhm.
And I mean, they were worse situations than now, because at that time they had no way to talk to each other. They could not go anywhere. Now we have all transportation to at least go in a car somewhere to the grocery store. We have food available. At that time, there was not food. People were starving in these conditions. So we have plenty of food in the chain. There's no problem. Only thing, we cannot go out and socialize in the malls and in the parties. And it is just temporary thing. We cannot have big weddings. We are saving time and also saving a lot of money, not spending unnecessarily. And things, good things are coming out of it, as well as certain bad things. But inshallah, if we use all these methods of interacting and learning something positive out of it, I think we can manage this time
Hmm.
fruitfully.
Thank you, Dr. Hannah Kausar. I have, in summary, I would say we all should, and this is what is working for me also, we all should look at it in a positive way. We should all look at it like what Dr. Hannah said, that what can we gain from this time? Biggest things are families are together, college kids are home. Like I have a house full. I had all my children gone. Now they were home and I really enjoyed it. We can cherish that moment. We all can do more, cooking. I have friends who are making them their cooking taking their cooking to a different level. They're cooking things that they have never cooked. All these recipes are available on online. We can do a lot of baking. We can start gardening. I have a few friends who started gardening and they are really enjoying it when they get their vegetables. And then all those knitting and stitching, sewing. um, so all these things can take us to a different level. We should come out of this as stronger. Another thought I have is we are making history. We are living in it and we are making history, and inshallah it will be over. We all have to decide that we are going to come out of it positive and stronger, and it will work. And I would summarize, just create some humor. Come up with some humorous. There are so many funny memes going around. Pay attention to those. I saw a little sticker going around. I wish I could show you. There was a little old lady standing with a cane, white hair poofed up, and she's saying, "Hey, is it time to take a shower, or are we still washing hands?" So things like that. And
Mhm.
so I would summarize that all these things are routine, normal stress. However, if there is anything that is going on for too long, it is interfering with your daily life, please consult a therapist or a counselor or a doctor. Please seek professional help. Dr. Heather has also mentioned in that couple's case who was arguing that please, please, please do not ignore if things are not getting controlled. Please seek professional help.
One thing I would end with this, that we're going to inshallah start continue with these Zoom programs for our community to help out with different issues like nutrition, health, what to eat right during this time, weight control, because we eat a lot in sitting home, not doing much. And that's all we do, go back to fridge over and over again to eat.
That's true.
And I heard a lot of people are doing, the kids are doing, and people are gaining weight. And I think we'll come up with some more lectures of the Eid is over, and we
Mhm.
say Happy Eid Mubarak to everybody. Although we cannot celebrate with each other, but we can say from our heart that we love each other, and we Eid Mubarak to everybody. And God loves us all, and He has mercy on us to end this pandemic soon.
Amen.
And
Amen.
please do Zoom meetings on Eid day with each other. Get dressed and do the Zoom meetings.
All right, I guess.
Show off your Eid clothes.
Yes, sure. All right. I guess we're going to end our program today with prayers that everybody has a good Eid and everybody, God keeps everybody safe during this time.
Thank you very much.
Amen.
Thank
Amen.
you, everybody. You take care.
Thank you, everybody, for a great
Bye
lecture.
bye. Thank you.